right. Let's see, Jennifer, you think we should get started? Yeah. All right.
Yeah, I think so. Thank you.
Well, thanks everybody. This is great. I see some new faces and names here, so that's really exciting. My name's Zoe Reese, and I'm the new Director of Community Impact and Grant Making here at Verdant, and I'm excited to be meeting with you all today about our upcoming grant opportunities. My colleagues Jennifer and Tammy and I will be going through some slides with you today. We're hoping that you can quickly introduce yourself just in the chat box. So name, organization, and if you'd like to receive this recording and or the updated slides that we'll be sending out with the question and answers, go ahead and pop your email address in that chat box as well. Throughout the presentation, we're hoping that we can use the chat box to start gathering questions. We're going to try to hold questions till we get through our first slides, just because we might answer your question, right, in one of these slides, but if we don't, we sure want to make sure we get to it. So throughout the presentation, put a question in the chat box, and also we'll have the opportunity, we hope, a good chunk of our time together for just open Q&A will be part of our time together as well. As I mentioned, this will be recorded. We will be posting this updated slides and updated FAQs based on your great questions to our website, hopefully by the end of the week prior to the go live, so to speak, of accepting applications next Monday. And like I said, we'll try to save questions till the end in case we manage to answer them in a subsequent slide, but want to make sure that we get all your questions answered. Great. So going over kind of what we hope to accomplish together today, we'll go through some quick introductions of our commissioners and staff, talk briefly about Verdant's background, kind of who we are, the goal of our work, and what we are funding, the application materials themselves, the evaluation criteria we'll be using, some frequently asked questions that we have previously received as part of this process and or anticipate folks might have, specifically talking about our COVID-19 emergency response dollars, which are a separate pot of money. And then, like I said, hopefully having a significant amount of our time together be for your questions and answering those. Let's see, thank you. And Jennifer, do you want to take it from here?
Everyone, hope you can hear me okay. So I'm going to start us off and chat a little about who we are, some introductions. And so you see before you on the slide, commissioners. So we have a board of commissioners that govern our organization, the Verdant Health Commission, and you see their photos and names there. They are Dr. Jim Distelhorst, Bob Knowles, Dina Knutson, Fred Langer, and Kariana Wilson. And I believe we have Dr. Distelhorst on today's call. So I wanted to say thank you to him for joining us today. I'm not sure that we have any others. Forgive me if I'm missing you. And then also just wanted to update you with our current staffing. So as of this week, we are fully staffed, and it is the first time in 1.5 years we've been fully staffed. So it's very, very exciting for us at Verdant to be able to share with you this list of our 8 employees, full-time employees, and sort of the areas of work that we do at Verdant. Today, you'll be hearing from myself and Zoe, as you've met her already, and Tammy Koiser, our Finance and Operations Director, who joined us recently. So a little background to start us off, if you're not already familiar with us. We exist really to improve the health and well-being of our whole community. That is our mission statement. And you'll see there in our vision statement to be a sustaining public resource, improving health and well-being of South Snohomish County. And we do this collaboratively and creatively by working to meet the needs of our whole community. I'll talk about what that means, the whole community, from a geography perspective, but really we want to be inclusive of everyone that lives in this community that we serve in South Snohomish County. I'll talk about that geography in a minute. You'll see there that we are the program of Public Hospital District Number 2, Snohomish County, and we are governed by that board of commissioners. They are elected by the voters of our district. and again, talk about the district in just a minute. I wanted to share a little also about the background of our grant funding. For those familiar with us or new to us, we began making grants in 2011 when we launched as the Verdant Health Commission. And we started with one-time and multi-year program grants that were being reviewed monthly on a fairly regular basis. And then we also issued special calls for proposals on topics of interest. So things like behavioral health, childhood obesity, and some infrastructure improvements to support health and well-being have all been part of an RFP process we've done in the past. So from 2011 through just about the end of 2019, that was the way that we were making grants. In light of some of our decrease to staffing that we were experiencing in late 2019, we put a pause on new grant applications. And when COVID hit in 2020, our board did authorize some emergency grants that were in response to COVID-19. And so in 2020, that's really the work we were doing around grant funding. 2021, you see that we are launching a new opportunity, sort of our quarterly windows for one-time and multi-year program grants. And then we are continuing to do ongoing requests for COVID responsive emergency kinds of grant programs. And Zoe will talk a little about that later on today. I wanted to highlight the geography that we serve. As the public hospital district, we have a very set geographic area. And so you see before you a map that shows those boundaries with sort of the cities overlaid that serve our district. So just to orient you a bit, the boundary to the south is the King County line. The boundary to the north is 148th Street Southwest approximately. To the east is a little tricky. There is no straight line that aligns with streets in our district, but you can see that we include portions of unincorporated Snohomish County, even a little corner of the city of Bothell. For those of you familiar with the area served by the Edmond School District, this is a very similar boundary area. We extend a little further east than the Edmond School District does, but that's a fairly kind of an easy comparison a bit. And then I also wanted to share this map in regards to our zip codes. So similarly, the boundary to the east, to the south is the King County line at the bottom of the map. And then of course the Puget Sound to the west. So you see the blue lines that indicate the boundary to the north and to the east, and it does cut through a couple of zip code areas. So they're listed numerically on the right side of the screen there. But it is a list of zip codes that encompass those communities that you saw, portions of unincorporated Snohomish County that might include Bothell addresses. It also includes, you may see on the list, 98046, which you don't see on the map itself. That represents PO boxes in Linwood. So this is sort of a complete list of all of the zip codes that are either completely contained or extend into our district. So when we talk about serving our residents or serving our community, this is the geography that we're talking about. It does represent nearly 200,000 people, so it's fairly large in terms of population. All right, I'm going to turn it back over to Zoe.
Thank you, Jennifer. Great. So I'm going to just start going over kind of the purpose of our funding, as well as some of the documents and eligibility. The goal of our one-time and multi-year program project grants, which as Jennifer mentioned, we have not been able to provide due to staffing for over a year. So we're very excited to be launching this. Support projects or programs in South Snohomish County that support our mission of improving the health and well-being of our whole community. So of that service area with those geographic kind of constraints of residents in that area. We are seeking projects that address priority areas that are identified by our commissioners. And we'll go to the next slide. We'll talk through what those priority areas are. So some of these will look familiar to folks who have been partnered with Verdant previously or currently. So access to healthcare, behavioral health, childhood obesity, dental care, supporting seniors, and other education and prevention have been long-term priority areas of Verdant Health. And in 2021, we added food insecurity and housing to our list of priority areas. I want to call out specifically on two of these buckets. We move to the next slide. Housing, kind of what we mean by that is helping people gain and sustain housing. So it does not include capital development of housing itself. For other education and prevention, this is kind of a broader definition or catch-all for ideas that support resident health and wellness that may include addressing social determinants of health or other emerging needs that don't fit into one of those kind of more finely defined priority areas. For funding parameters moving forward, there is no minimum request for these one-year or multi-year grants. We expect the average grant size to be around $150,000 per year, but again, there is not a firm maximum either on this funding at this point. We may fund multiple projects projects in each priority area, so it won't be only one for each or something like that. Funds must be used to meet the health and wellness needs specifically of South Snohomish County residents. So again, going back to the zip codes and or map. And funds will not be awarded for the benefit of an individual person, for political or religious uses, to retire debt, or strictly for fundraising purposes. On our website, you'll be able to access 3 documents that will comprise our application. One is going to be a Word document that will include some information about your agency as well as more a narrative component. And then we will have an outcome spreadsheet and a budget spreadsheet, which we'll walk through in a little more detail together. All of these are currently available on our website. We did upload a slight edit to the Excel spreadsheet. So if you happened to download them before, I think maybe yesterday, there might be a slight change in one of those documents. All of the application material, so those 3 documents will need to be emailed to me, my contact information down here, by February 26th at 5 p.m. Incomplete applications will not be scored, but I will be reviewing submitted applications for completeness. And so prompting people if they submit something that isn't complete around what they would need to provide in order for it to be complete. I think as we move forward here, so orienting us to this will be the Word document itself. And we're wanting to highlight kind of some of the changes maybe from previous Verdant materials. Really, these are kind of just small edits to forms and guidance that you're probably familiar with, but they may look different as we kind of have a new edit of our Excel spreadsheets. And we have added some additional focus both in the application as well as the evaluation around equity, diversity, and inclusion. So as you look through the Word document, you'll notice similarly, we have a checklist at the top of all the required components to be included. This includes things like your list of board of directors for your organization, current financial statements. Other attachments that would be accepted but are not required include things like letters of support. We would say if it's really important for your proposal or for us to know about you, include it in the narrative. And then this piece we specifically wanted to highlight is the project budget. So historically, we have funded at year 1, we've approved kind of 3 years of the budget. So for this round, we will be approving the first annual budget amount, and then we will be finalizing budgets annually. So we wanted to highlight this information and kind of verbiage here as it is a slight change in formatting. Intention is that successful applications may be funded for up to 3 years, contingent upon the successful achievement of annual deliverables. Budget details should be included in the budget narrative and attachment, which we'll walk through. And then we'll be finalizing these annually. And so this is both an attempt to kind of have a little bit more ability to be nimble year to year as we learn more about the work and, hopefully for all our sakes, maybe have fewer amendments and or modifications as we are implementing this good work. Let's see. Also wanting to highlight that we did abbreviate the narrative response from previously from 10 pages to 5 and streamline some of the prompts that you'll see within there. We wanted to call your attention to this gray box here because there are kind of two ways you can provide the narrative response. You'll see the list of bullets, and the goal is that you respond to all of those bullets in a way that feels effective to you. So either by answering each under the prompt itself or just providing a statement that addresses all of those criteria. You can do that by adding pages onto the end of the Word document so that it totals 7 pages. It's currently 2, so you can have 5 more, or you can attach a separate up to 5 page Word document to the email. So at that point, you would be submitting this 2-page application that includes your agency information, a little bit more request deal, a 5-page Word document narrative, and the 2 Excel documents. And now I'm gonna hand this over to, no, this is me still, just kidding. This is my pretend nonprofit, Zoe's Pet Palace, that I have made up for the point of illustrating our new forms. So this is going to be both how you people will apply to show these are the outcomes that we are planning to achieve with this funding. You can, the gray boxes are the only places that you can edit. So when you see what's on the website, you will see kind of outcome 1, outcome 2, outcome 3. Instead of here, I've had dogs spayed or neutered at no charge. That is, I deleted outcome 1, added this, and added the annual goal. The thing that will also look different is when you're doing quarterly, semi-annual, annual reporting. It will be a very similar looking form where we'll be able to pull in these outcomes, and then you will be able to track progress towards annual goals on that cadence in a very similar looking format. And now I think I will hand it over to my colleague, Tammy. This budget document might look a little bit different. And I think what we wanted to highlight here is we've heard from some folks and in trying to review financial materials about what scope of budget information do people want? Like the whole agency? Is it specific to the project you're requesting funding for? So you'll see here that we are calling out specifically including budget for only the requested requested project or program, and then highlighting separately the Verdant request. So Tammy, you want to introduce yourself? And
Sure. Hi, everyone. I'm Tammy. I'm the Director of Finance and Operations here. So I thought I'd go over this a little bit for those of you that aren't familiar with Excel. They've really streamlined it, and it's pretty easy to read. And just like on the last form you were looking at, all of the gray boxes are the only ones that you can enter data into. So, and there's also formulas in there. So if you look towards the bottom of it, which is on the next page, it sums it up and it gives you the percentage. So what it's looking for in that first column is for you to put the total amount of the project. You don't have to look at it as the whole amount of the budget for your whole company or organization, but the project that you are looking to get funding for. And then in the last column is what you're expecting or hoping for from Verdant. And then at the bottom, it's going to show you how much is Verdant's piece. And the opposite side of that, of course, it shows us what your intent is in kind wise. So it's pretty easy to look at, it's pretty easy to read, and pretty easy to fill out, but that's what we're looking for in your application from your budget.
Thanks, Tammy. And important here is there's no minimum or maximum expectation on that Verdant percent line. It is just a different way for us to look at data that we are kind of currently collecting in 2 different ways. So to highlight that, hopefully this will be helpful for everyone. So moving forward from the materials themselves, and again, we were trying to highlight the things that we thought might look most different and or be confusing. You will also note that there is a survey link to evaluate the process and the materials as part of applying, because we do really want to hear from you. So we'll talk through that more throughout this presentation. The evaluation criteria here, you'll see a link at the bottom, which will take you to the specific scoring spreadsheet or matrix that staff and commissioners will be using to evaluate all submitted proposals. It is tallies up to a total of 100 points, and they're broken into these 4 buckets. So alignment with a Verdant priority area of up to 15 points, equity, diversity, and inclusion as a core focus of the program project design for up to 20 points, organizational capacity and financial sustainability for program or project, including after grant period, up to 25 points, and evidence of program or project's ability to respond to community need, up to 40 points. For the evaluation process, which I think is where we're headed here. So again, you can look at the specific spreadsheet we'll be using by following that link. And for the evaluation process, we will be, as I mentioned, having groups of staff evaluating either all components, subcomponents, and then they will go forward to our program committee to be scored by commissioners before going to the full board for review and approval. Importantly, but different, we wanted to highlight our COVID-19 emergency response grants. So these are accepted on an ongoing basis. They have the same geographic constraints or catchment area as our general one-year multi-year funding, meaning they need to be serving our service area and residents specifically. These can be short-term projects. They could also be pilots of something that you think would be effective as a response to a community need, but you're not ready to apply for a full year or traditional funding for. There are a lot of things that they need to be focused on as a result of COVID, but when we talk through that, it can be either a direct result of people having COVID, of budget impacts of COVID, of social, economic, any impact that COVID has had. This is a broad, unfortunately broad impact with where we are right now in the pandemic. And we are accepting papers on a rolling basis. So requests will be considered as submitted, and staff will follow up to discuss more.
In Sicily, which was a Roman province.
Let's see if someone can, someone's unmuted. If you can mute yourself if you're not talking, that would be great. Thank you. And so this is a Word document that is available also on our website. It's currently there to download and complete. It is less detailed than a multi-year or annual funding request, and is we kind of view this concept paper as the conversation starter. So reviewed by staff, then I follow up to get some more information, better understand, and kind of take it from there. And again, that is ongoing, so not part of this quarterly process. I think this is back to you, Jennifer.
I can walk folks through some of the questions that we often get and trying a little to anticipate questions. So the first being, do programs or projects need to serve a specific population? Really what it comes down to is the residents of our district. So we walk through the maps of what those look like. But beyond that, your application can specify a specific target audience within the residents of our district, but we're really just focusing on that specific geography. So if you've got a project that might be tailored to a certain age group or something of that nature, that's totally fine and encouraged. Who's eligible to submit an application? So we accept applications from nonprofit, from for-profit, and government organizations. Really the focus is as long as they match our guidelines and eligibility criteria, they'd be eligible to apply. Okay, the next questions. If my program or project is currently being supported by Verdant and is set to expire, can I renew using this process? Yes, this is our new approach to both renewals and brand new grant requests. We would encourage you to apply for renewal in the window prior to when your current contract is set to expire. So we'll be accepting applications for this current round of funding February 15th to the 26th. The next round of funding is May 17th to the 28th. So if, for instance, you are currently under contract set to expire in June or something like that, May might be the right window to apply, but let us know if you have questions about that. Can you submit multiple applications? Yes, you can. Organization is not limited to just one request from us. And how should they be submitted? We're looking for these electronically sent to Zoe. However, if there's any questions or concerns about providing it electronically or working with the documents themselves, with the Word or the Excel files, please reach out to us. We can work with you on how to adapt. Next, I just wanted to highlight a bit about our timeline. So we launched this or shared information about this funding opportunity last month in January, and today, of course, is the community Q&A session. The window for applications to be submitted is next Monday, February 15th through Friday the 26th. And as Zoe mentioned, we'll have a review process that will include both staff and commissioners. So the program committee is the name of the subcommittee of our Board of Commissioners that's engaged in that work. And they'll be meeting the week of March 8th to review applications. Our full board meeting takes place on Wednesday, March 24th. And that is the meeting in which we expect decisions to be made around funding. And so communication would come out to all applicants in either the same day or the day that follows, with the anticipation then of working out contract details so that the contracts could start on April 1st. And again, that next window of applications in which we'll be accepting applications is May 17th to the 28th. So that's a little about that timeline. Wanted to display these, my colleagues' contact information. Zoe and Tammy will be your kind of best points of contact for questions around the documentation and the materials you're submitting. So we encourage you to get in touch with them directly if you have questions. And now is the time, I think, when we're going to turn it over to questions. So I'm going to stop my screen share so I can see more faces. And let's see if we have questions come through the chat section first. We start with that.
I haven't seen any questions yet on the chat board. So just know if you're muted or you don't want to talk, if you put something up on the chat board, I'll read it out for you.
You can also unmute and ask questions.
I have a question. You talk about the budget, using the whole budget for the program. Do you mean the program for the Verdant Health area or the program for the whole county, for example?
It's a great question. So I would kind of my assessment, and Tammy, please chime in if you disagree, it would be really hard to tease out which of the entire program, if it is multi-county or full county. I think what we are looking for is that your Verdant request is specific to and can demonstrate that it is just for the benefit of our service area. So you would submit the whole program budget and then calling out in your Verdant request that is specific for our area.
Did that answer your question?
It did, right up until the very end, when then I got confused again. So
That's okay.
I think what you're saying, Zoe, is so for example, our early intervention program, which serves beyond the Verdant area, but I would take the budget for the Verdant area for that program and then demonstrate the part that's funded through other sources and the part that we're requesting Verdant to fund.
Exactly.
Okay.
Thanks, Terry.
I do see a couple questions that came through the chat. One about if our priorities and interests have changed. So, and if we have a recent needs assessment. So those are great questions. Zoe, do you want to?
Yeah. So the priorities, we haven't taken off any priorities. We did add housing and food insecurity as new priorities. We had a fairly recent kind of collaborative community needs assessment from the individual areas, but they were all pre-COVID. So of course, we feel like the honest answer to that question is no, given that COVID has been such an enormous impact. So that is a project and process that we are starting this year with the goal of having an updated community needs assessment by 2022. So trying to use what available data we can, but knowing that not a lot of it reflects the significant impacts of COVID. I don't know who asked that, so I'm just looking around at all of
That was Gayleen Vaden.
Okay.
I'm sorry if I pronounced it wrong. I see your hand up there. We have another question here from Susie Chandler.
Yeah.
Are there any technology loaner programs already underway, such as tablet loaners for seniors, or should we request our own?
Great question. And I wish that I could tell who I like looking at people in the eyes when I talk to them. Oh, thank you, Susie. Okay. Yes. So there are a couple programs. We've been partnering with Homage and the Waterfront Center around a project called Senior Tech Connect. And there is and so that's the goal of getting technology to seniors and also helping them with how to use it. So utilizing kind of tech support trainings for caregivers and seniors. And then
that was Homage and who?
And Waterfront, Edmonds Waterfront Center. So the new Edmonds Senior Center.
Oh, great.
And then there's also a nonprofit that is, I think, national, but there is a new chapter that includes Snohomish County that they are working to get donated technology to kind of higher need medical centers. And I believe they're partnering right now with CHC of Snohomish County. So there's a few things, but I would say that shouldn't, if you feel like your needs would be met by those programs, but they may not be, right? So that's not a really clear answer, but to say
that's exactly what I want. Yeah.
Okay. Okay. Yeah.
Okay. Our next question is Jeremy Peck. I can see you. Maybe wave. He asked, can you clarify what to submit in the grant period field, our fiscal year versus your funding cycle?
Great question. So we would be asking there to be our funding cycle. And so in terms of the dates that you're depicting in the budget, is that what you're meaning, Jeremy? Yay, nay? Yay. Yeah, so that would be for our funding cycle. So starting 4/1/2021 or after. I think if you have something where you're like, we have this fantastic idea, but we want it to start April 15th, right? That's not a deal breaker. And then reflecting if it would be a multi-year or 1 year project request. And I know that's hard, having done a lot of work in schools where I would get school year budgets and match them up with calendar year budgets. That can be really tricky when you're pulling out the comparison of an off year budget to a different calendar budget. So we can talk that through, Jeremy, if you want to talk through the details, or Tammy as well. Yeah.
And then, yeah, just to follow up with that on how to indicate you want to submit a multi-year request.
There will be a spot in, I believe it's in the narrative, where it will say the intended duration or time frame of the project. Okay. And so you'll be able to highlight that there. And there's no preferential treatment for 1 year, 2 year, 3 years. But there will be an opportunity to reflect that.
Thank you, Jeremy. Now I have one from Becca Judy. She asked, we're looking at startup funds for a new BH program, behavioral health program in Everett, but would serve individuals from the service area. 2 questions. 1, would this qualify if we would serve people from South Snohomish? And 2, are startup funds considered as a one-time funding possibility, including curriculum, client supplies, and some infrastructure?
Yeah, so that's a great question. And I think we always say ideally the services are provided in our service area, but we know that it's not always possible to create all services that folks need within our specific geographic bounds. So I would say that is our preference. But if you could clearly demonstrate that people would easily be able to access the services that you're describing, I wouldn't say it would be, it would exclude the request. I think we would just really want to understand how it wouldn't be a barrier for our folks to travel. And then Jennifer, on the other piece, is that feel fair? Yeah. And then the
I
other
think so,
piece
yeah.
for the startup costs, certainly basically everything but capital in terms of startup costs, but staffing, curriculum development, supplies, all of that would be an appropriate request currently. We are having kind of early conversations about as an organization what we want our or can do for capital. So, but at this time there, it is not part of the funding.
Okay, another question, so kind of piggybacks on the first part of that one. This is from Kathy. Our shelters are all over Snohomish County. The main shelter is in Everett. Our clients come from all over Snow County. Is that okay?
So I would say similar answer to the previous one is that we want services and resources to be low barrier and really accessible to our service area. But again, we also understand that not everything has to be replicated specifically to our catchment area. So I would say if there's a good demonstration that the shelter is truly accessible, right? So in terms of how people would get there, how they would be transported back to South County, if that was where they identified as having community, I think we would just want to better understand that piece.
And Kathy goes on to say services are very low barrier. And then I think we're back over to Jeremy again. He wanted to know, he said, can you talk about the reporting process of those contracts ending and the new ones going forward?
Yeah, so this is a fun time for folks who might have contracts in both worlds because the documents will look a little bit different, but it is similar so that you would be reporting on progress towards the annual outcomes. And then we have an abbreviated demographics report. So that should look like very similar content to what you currently report on. And then the kind of budget to actual financial reporting. So at either a 6-month and/or annual cadence. We want this to be, and I think we'll call that out too in the documents. There's not an expectation that people have like 15 measurable outcomes, right? We would say the outcome we want to see from everyone is participants, right? Like how many folks do you feel like you're going to support? But it may be that you only have like 2 or 3, or maybe you have 5, right? The goal is not to have so many things that it becomes really challenging to report on. It's really to highlight the things that are most impactful and important about the work that you would do with these funds. So we want it to be simple and impactful, I guess I would say. So it's that for the reporting as well as for the application.
Thank you. Maurice, he said, I'm new to Snohomish County, so I'm learning the areas. My nonprofit is in Everett, 98203. I considered this South Snohomish County. Would my zip code area be in your target range for funding, or would I have to service a lower area more towards Linwood?
So welcome to Snohomish County, Maurice. I am also new-ish to working here. So Jennifer, I am going to defer to you on that specific zip code. I haven't memorized it yet.
Sure, I know, and we use South Snohomish County sort of loosely, and that can be interpreted, different ways. We're often asked if we include Mukilteo, right, for instance, or Mill Creek. Because of our structure, because of our background as a public hospital district, we really are explicitly to kind of that map area that we serve, which does not include any parts of South Everett. So that 98203 zip code is outside of our service area. So we'd be looking for requests that really are able to target and serve the people that live down within that boundary on the map. Does that help? Okay, thanks.
Okay. Lynn Varner. Oh, he said, oh, by the way, Maurice said, yes, thanks. Lynn Varner, can funding be requested for the expansion of an existing initiative outside of Snohomish County to be expanded, co-located to within the county? That's interesting.
Yeah. I mean,
I'll add to that I just think sometimes we don't need to reinvent the wheel, but simply take a successful program elsewhere. And if we can prove the impact and efficacy, introduce that to Snohomish County, but I didn't know what your rules were.
No, certainly. I think it does not have to be a brand new program, right? We're not saying like, we only fund brand new stuff. It can be an existing program just needing to be specifically happening within our area and or specifically to the benefit of our residents. My screen just moved around, Lynn. I was like, where'd you go? So,
and I would just echo that's not, that we've supported programs like that in the past. They've been great ideas in other neighboring communities. And if there's an organization that wants to bring that to our service area, then fabulous. Excited to hear about those types of ideas.
That's all I have so far in the chat room. Everyone's welcome to speak up too if you have any more questions.
Can you all hear me?
I can.
Hi. Sorry, somehow I'm logged in twice. I was on a walk earlier and then I logged in at home, so I was hoping there wasn't going to be an echo. So you had said that this wouldn't cover capital costs, and I just wanted to clarify something like IT startup costs would not be covered could not be covered with this.
So you see my face, you may not be able to see my face, Becca. Coming from like federal grant background where I'm like, oh, it's such a good question, right? Because capital is often defined as the total dollar amount and or years of usability. I think that one, and Tammy, I will defer to you, but that one feels like it could potentially, depending on what it is, if it's the purchase of laptops or things like that, that could be a supply versus a capital expense. But I'm happy to talk that through. And I don't know, Tammy, if you have other thoughts.
It's just going to be something that's going to have to be reviewed on an individual basis and talked through, like you say.
Okay, that's helpful. Because and this was also for the question regarding a program in Everett, and it's a residential program, and so certainly its location would not preclude us from accepting people from anywhere in the county, unlike maybe a drop-in clinic or something along those lines. And so I was just trying to gauge from that perspective. So that's helpful. Thank you.
Yeah.
We have another typed in question from Omar Gomez. Can you give some examples of some programs that have been funded in the past?
Yeah. So many, which is something that's really great. So I think some of the folks who are on this call are current grantees. And so I would say we have kind of breadth of direct services. So funding programmings to provide clinical or support services to folks who may struggle to get them otherwise. So places like CHC, Snohomish County, Lehigh Dental, Compass Health, and as well as funding food resources, so food banks, nutrition education, school-based programming like Move 60 or summer lunch programming focused on McKinney-Vento kiddos, early intervention targeted at 0 to 3-year-olds who may have speech delays or disabilities, senior centers and programming to support vulnerable seniors, and kind of there's so much amazing work that happens in partnership with Verdant. So lots of different types of work, I would say. Is that helpful, Omar, though? I can't see Omar on my screen, I don't think.
I can't see him either. He said yes, though.
Oh, great. Okay. And I guess another thing I want to make sure is this is not a one-time offer of talking through questions. You can reach out at any time. So we'll be sending out these slides and posting them on our website, updating our FAQs. You can reach out to Tammy, Jennifer, and I, reach out to all of us at once, anytime if you want to talk through a question you have or to say, you know, something really specific to your organization, please reach out. As you know, we don't want people to feel like they need to do this in a vacuum. Happy to talk through the process or the forms or kind of what you're thinking as you review or ponder.
Zoe, could you all talk about the equity and inclusion piece, what you all were thinking when you include that, how this year has focused or shaped your thinking around that?
Absolutely. Yeah. And I think the way I would say we're starting this, right? This is a new focus, I would say, for Verdant in this work. And the way we've really frameworked it for this first time, including it, is by calling out the desire that the populations that have been identified as being served by the work, so the community members or otherwise, are involved in planning, implementing, and evaluating that work. So to say, how are communities involved in saying, this is what we think we need to address this issue, this is how we think it should happen, did it happen effectively to our needs, as well as hoping to highlight agencies where staff, so staff from the program itself, as well as organizational leadership, reflect the communities served. So that can mean a lot of things, meaning could be racial, ethnic, socio-demographic, language, all kinds of different factors that we would say we just want to make sure folks are involved kind of at all steps. Does that feel kind of like what you were looking for, Lynn? Okay, thank you. And it's a process. And I would say, again, there's going to be a link to a survey within the form itself, asking you to kind of provide some feedback around the process, the forms, everything. And we really mean that we want that feedback, because we are really committed to ongoing improvement and want to make sure that our work and our processes and our materials are collaborative and effective. And if we miss the mark on anything, we would really appreciate the opportunity to hear about that and learn more. I don't know what I'm hearing.
That was just an accidental unmute, I think.
Oh, feel free to continue to ask questions. I just wanted to remind folks, we'll be posting this video and these slides on our website this week. We have an FAQ document on our website right now that's a work in progress. We'll be adding to it based off of questions that you all asked today, so that others who just want to refer to it in that print form can find that online, with our goal of getting all of that posted by Friday, so that you've got, that 2-week window to submit applications, and all the materials would be there on the website for you to refer back to. If you're interested in receiving an email with a link to those resources, and you haven't already, feel free to put your name and email address in the chat. We'll pull directly from there and make sure that you get it directly in your inbox. If you don't want to put your email and contact info there, just feel free to come back to our website and you'll find it there by the end of the week. I see a hand, Jackie. Julian, do you have a question?
Yes, hi, good afternoon. Thank you for sharing. I had a question related to, you talked about leading, right, with equity, diversity, and inclusion. I'm curious of what the makeup is of the review committee that's going to be reviewing the applications.
A great question. So I would say I don't think we are leading in equity. I think we are learning, I would say. So the current reviewers of our is just our staff and commissioners. And so for folks who have worked with us, there's the 5 commissioners who were on one of those early slides, as well as all of our staff members will be reviewing. But we are talking about the ability of creating kind of advisory groups, so to speak. And I know our colleague Sandra is helping to think through how we could do that, just to make sure outside of our current staffing and commissioners that we have a more diverse and representative group of folks reviewing and informing the funding process moving forward. Does that answer your question, Jackie?
Yes, thank you.
Yeah. Look at the chat box here. Okay. If there are no other questions, certainly not a need to fill time, but trying to work through, and oh, it looks like Sandra did put in the chat here that goal for the advisory board is that it will include community members. Yes, thank you for clarifying that, Sandra. Yes, that would be absolutely the goal, is folks who are living and benefiting from the services and in our area, as well as people who are working within agencies doing that work. Thank you, Sandra. And I think, again, we'd love to hear what you think. And the evaluation piece, now or anytime, please reach out if you think there are opportunities or different approaches we could be better taking.
We're excited to see you all here. Thank you so much for taking the time out of your afternoon to join us. For those who've been on staff for a while, this is a long time coming. It's very exciting to be relaunching this. And I see Dr. DeStores nodding along. We're really eager and excited to see what ideas and what we can do to help in the community. So I just wanted to add that. Thank you very much. We appreciate all of you. Any other comments or questions for the good?
It looks to me like most of you have added contact information on the chat board. If you haven't, please do that so we can get information out to you. I'm pretty sure we covered all the questions that were out there. Thank you all so much for joining us.
Great. Look forward to being in touch with everybody. Thanks so much.
Thanks, everyone.
Thank you.